Good afternoon, everybody. This is Tanvi Arneja, clinical psychologist, and we also have with us Dr. Anu, who's a psychiatrist. And we'll be starting shortly in about 5 minutes. We're waiting for more people to join. Thank you. Hello, everybody. Happy Women's Day to all the women out there joining the webinar. Thank you for joining in. So, we'll be starting the webinar, and the topic for today's webinar is women's sexual health. So, firstly, it's important for us to understand what is sexual health because it's not a very talked about topic and there's not much awareness regarding it. So, it's important for us to understand what is sexual health in general. So, starting with that, so sexual health is defined as a state of physical emotional, mental, and social well being in relation to sexuality. So it's not merely absence of disease or dysfunction, but it's just a general healthy and satisfying sexual life that aligns with your values, your respects, and your rights and well being of yourself and other people. So this is it's important for us to understand, develop a holistic understanding of sexuality that aims to promote a supportive and inclusive concerns in a safe and consensual manner. So now let's try to understand why is it important to know about sexual health in the first place. So it's important to know about sexual health because it has certain benefits. So first benefit is that it promotes physical well-being. So if we are aware of our sexual health, it enables us to take informed decisions regarding our bodies, our reproductive systems, and overall physical health. It helps us to prevent unintended pregnancies, any sexually transmitted infections, and also helps us to be informed about our reproductive health issues in general. Second, sexual health helps us to understand our emotional well-being. So, emotional well-being in terms of it helps us to foster positive relationship with one's own body, one's own sexual experiences. It helps to have confidence, reduces anxiety or shame associated with any sort of sexual experience, and promotes a healthy body image in general. It also helps to build positive and healthy relationship with our partners. So understanding one's sexual health helps us to have an open communication with our partners and also have healthy relationships and maintain a sense of boundaries and foster mutual respect between each other. Understanding sexual health also helps to navigate through important life transitions. For example, we all go through different periods in our life, such as puberty, menopause. So, understanding about sexual health, what can be some of the changes that women experience in general, can help us to navigate better in terms of understanding those things. Lastly, it's important to understand sexual health because at the societal level, it's very important. There are a lot of taboos that are related to sexual health, and just understanding, being aware, and being knowledgeable about it helps us to spread awareness regarding the same. So, that's some of the reasons that it's important to understand about sexual health.
Now coming on to the normal changes जो across the age group होते हैं, we see that sexual functioning starts and sexual behavior starts as early as during 2-3 years of the age, but it's not well understood per se. Primarily हम sexual जब हम बात करते हैं, so it comes during the adolescent or during the early adolescent phase, wherein the person is developing secondary sexual characteristics. So puberty आती है, during that time you are having a lot of hormonal changes, bodily changes, which leads to increase in the sexual curiosity. Now this is the time when you are identifying yourself as a male and a female, and you try to understand your liking and disliking towards one sex or one particular gender. So your body image issues are there. A lot of you start defining your body image, you start defining your sexuality, your orientation, and your preferences. Desirability increase होती है, peer acceptance आती है. During this is the phase wherein you do a lot of experimentation. So we see that adolescent phase में या during this teenage phase बहुत सारे male or female they engage in certain homosexual or heterosexual activities regardless of how they identify, because this is the age wherein they are actually trying to understand what kind of likings they might have, what are the things that they like, what are the things that they do not like as a person and as in your partner. So this is the time when you actually start exploring. Then comes if we talk about females, so usually it is considered that your first sexual encounter or the first coitus, it is going to be painful, and it is told and repeatedly inculcated into your brains that it has to be painful, it will be painful, so you have to accept it. But it's not necessary कि आपका जो फर्स्ट इंटरकोर्स है या फिर फर्स्ट टाइम जब आप सेक्स करते हो, पेनिट्रेटिव सेक्स करते हो, इट हैज टू बी पेनफुल. मोस्टली अगर पॉजिटिव इमोशनल रिलेशनशिप है, you are able to discuss things with your partner, you generally will experience a much better sexual intimacy rather than just going into it not being able to communicate through with your partner. So these things, they happen during the first intercourse. If we talk about the late 20s and middle age, so that is the age when, especially in Indian population, you start getting married, you get involved with your partner. So you have a person, you have a partner, so your and your sexual desires and this is the time when you start experimenting more. You try to find out different things that are more so during this phase it is very much important to have a good communication along with your partner, because if you're not able to communicate your likings, your dislikings, you will not have a congenial relationship with your partner, and you will not be able to actually have a pleasurable sexual relationship with your partner. Middle age is the time when your roles start shifting. You become a mother, you
कौन?
they are think that this is the time when you actually do
विराज के
not.
लिए विराज के लिए ठीक है मैम आई थिंक
Hello,
मंजू
Manju.
प्लीज म्यूट
Yeah. So this is the time when people start expecting that your sexual desires or your expectations, they come down. You do not want to engage in sexual activities, which is not true, right? In older age, if we say it is kind of a taboo to even talk about older females having being sexually active. Thinking about that, okay, even in at the age of 60, at the age of 55, 60, 65, that they are going to be sexually active, which is completely false, completely wrong. They are sexually active, and to have a good relationship with your partner, it is very important to actually be sexually active. Definitely a lot of hormonal changes have happened. There is lack of lubrication, there is lack of sexual desires, you have difficulty reaching climax, but then it's not like you do not have any sexual desire at all, or thinking about sex is a prohibition in that phase. uh, yeah. So then, if we talk about certain myths and certain facts about sex or sexual functioning, first is sexual dysfunction. As I said, that it is considered that in female, sexual dysfunction is a hormonal problem. Now, that is not a fact. A lot of times, there are multiple causes which are there which can lead to sexual dysfunctions. Eventually, we'll discuss about some of them after during this webinar. But definitely, it is not just a hormonal problem. Sex education, it is believed that sex education leads to early initiation of sexual activity. So it's better that we do not talk to our kids or teenagers about sexual functionings, or sex education should not be provided to them. Completely wrong. Rather, you are depriving them of a safe environment. We do not provide them the actual information. They have a lot of myths and conceptions about what they should be expecting out of and they are definitely, as we discussed, that this is the age when they actually become very curious about things. So they might end up doing some unprotected sexual activities, which might lead to teenage pregnancies, sexually transmitted diseases, and a lot of other problems. And definitely a lot of anxiety and build up tension would be there around that area. So definitely providing sex education to your teenagers or to your kids is not going to lead them to a early initiation of any of the sexual activities. Another thing, as we talked about, is that it is considered that females usually have a low desire or low libido. Again, not true. It has been seen in studies that females have at par or is equal. They have equal amount of sexual drive, sexual desire as compared to males. Another myth is that if a female is having some sexual issues, they have to deal with those issues on their own. just like low libido or painful sexual activity, which is generally known as vaginismus, or if she is suffering from vaginal dryness, she has to take care of it on their own, which is again not true. A lot of times you think that okay, it is normal also. As I said, people generally consider that first sexual activity has to be painful. Not true. Well, a lot of people have this myth that usually the sexual pleasure depends on the size of the genitals, both in case of males as well as females, which is again completely untrue. It is not there. Your sexual satisfaction actually involves a lot of communication, emotional connection with your partner, compatibility with your partner, and it has nothing to do just with the physical aspect of it.
So to continue the myths, some of the myths that we can include and we know about are, so one can be that females have low sexual drive than males. However, this is not true at all. There is no gender difference in terms of desire. There can be factors such as motivation level, arousal that makes it different, but believing that females have a low sexual desire is completely false, and that's not true. Both men and women can have the same or even increased more like sort of a sexual desire. Another myth is that having unprotected sexual activity during periods does not cause pregnancy. A lot of us do believe in the fact that having sex during periods is quite safe. It is safe, but it is like not uncommon that you can get pregnant even during your periods after having like intercourse. Another myth is that sexual drive decreases or is absent after menopause. So menopause is a definitely period where women go through a lot of changes. But then to say that sexual drive decreases or is absent is completely false. There can be a lot of changes at that time that women experience, but it does not necessarily have to like affect your sexual drive or decrease it. So in order to believe that after menopause women will completely lose their sexual drive and there will be no pleasure involved in it is completely false. Next is sexual intercourse is supposed to be painful the first time. So, like we've already discussed, this is again a myth. There can be a lot of factors, such as maybe because you're having it for the first time, you can be uncomfortable, your relationship with your partner, your previous, if any sort of experience can have an impact, but does not necessarily have to be painful the first time. And last myth that we'll be covering is that all females orgasm during vaginal or penetrative sex. So studies have shown that nearly about 75% of women do not orgasm during vaginal sex alone. So women feel ashamed, they feel embarrassed that why aren't we reaching and like achieving an orgasm during vaginal sex? But then research has shown that this is completely a myth, and it's okay for women to not feel like to have an orgasm during vaginal sex alone. So now we'll be covering about female sexual dysfunction. So there are certain concern areas that we all should be aware about, and only once we are aware about, we'll be able to identify if if we or someone we know has any sort of concerns, and we'll be able to come forward for help. So first, let's understand what are female sexual dysfunctions. So female sexual dysfunctions can basically be defined as any way in which the woman is unable to participate in a sexual relationship as she would like. So she sometimes does not have the desire, sometimes is not able to have the arousal level, and basically is not able to participate in the factors that can be associated with it. There are several causes which we'll be discussing now.
Again, female sexual dysfunction. So it is very complicated. It is not just one thing which will lead to the sexual dysfunctions. A lot of neurovascular processes are involved. A lot of psychological causes are there, which we will talk mainly about. And बहुत सारे hormonal factors भी involved होते हैं. So your body is a mixture of all these processes. It's not just that isolated one thing that can cause dysfunction or problems. If we talk about medical causes, so that is something that is very, kind of, it will become more of a treatable thing in terms of medicine, wherein you might have certain anatomical problems. जैसे आपके genital area के अंदर there are certain infections or there is inflammation which leads to pain. You might have UTI, and which leads to again a lot of painful activities might be there. A lot of times, sexual activity might cause UTI, and then it becomes a vicious cycle. You may have some trauma. There might be some, vaginal, cervical cancer ज़्यादा होती है. As you progress towards older age, आपके estrogen levels कम होने लग जाते हैं. You reach that perimenopausal age या फिर menopausal age. Then again, you start having a lack of estrogen, dopamine कम हो जाता है. So because of, again, these hormones are a lot related along with your neurotransmitters in brain. So because of lack of these hormones, your neurotransmitter will also get affected, ultimately leading to a dissatisfied sexual life. Then a lot of times, if we talk about mental health, हमारे depression, desire to have any activity for that matter, and when it comes to sexual activity, definitely it is affected. In bipolar, we see that females के अंदर बहुत ज़्यादा बार ये देखा गया है कि because they become more impulsive, your sexual drive is increased. बहुत बार they end up having unprotected sexual activity and leads to some unwanted pregnancy, and again it's a problem array of शुरू में बहुत सारे लोग once my anxiety comes down, I'm your confidence at that particular point in taking substance. So that happens in the very initial phases, like शुरू में जब आप लेना ये शुरू करते हो, at that time maybe you feel that it gives you a बाद में I'm able to have a better life, better sexual life. Ultimately, when it comes to long term, they affect your sexual functioning to the extent that you end up substance. And now this is disorders which may lead to certain sexual problems in male and female both, but as we are talking more about females, तो उनमें बहुत सारे हमारे ऐसे medications भी होते हैं जिनकी वजह से ये सेक्सुअल डिस्फंक्शंस आते हैं. बहुत सारे एंटीडिप्रेसेंट्स, एंटीसाइकोटिक्स, इवन एंटी हाइपरटेंसिव्स, कीमोथेरेपी, रेडियोथेरेपी, स्टेरॉइड्स लेने से, ऑल दीज टेकिंग दीज सब्सटेंसेस, दीज मेडिसिन्स विल अफेक्ट योर सेक्सुअल फंक्शनिंग.
So these were some of the medical causes that we covered. Now it's important for us to understand what are the psychological factors that can affect, because as we discussed earlier, psychological factors play a lot of role in increasing, decreasing your sexual drive, and in like related to your sexual health in general. So one of the most important psychological factors is interpersonal conflicts. So interpersonal conflicts such as there can be relationship issues between the couple. If there are relationship issues, there are high likely chances that you would not want to connect sexually with that person. Extramarital affairs. So if you or your partner is involved with somebody else, there are chances that your current relationship will be affected. Any sort of physical abuse that you've experienced in the past, which makes it difficult for you to now like rebuild that sexual connection. Any difference in expectations between partners. For example, you have a different expectation out of the sexual experience and your partner has a different. So that will lead to a conflict and eventually like not make the sexual experience a healthy experience. Lastly, poor sexual communication. So if you and your partner, you are not comfortable in talking about any sort of sexual health related topics or any sort of topic related to sexual activity in general, that will lead to a problem and can cause conflict. Apart from this, historical factors such as any history of sexual abuse, physical, verbal abuse during childhood, during teenage, it has left a traumatic experience in your mind and you're so influenced by it that it becomes a problem in the present to have for you to engage in any sort of healthy sexual activity. Sexual inexperience is also one of the factors that leads to like affects your sexual health. So if you have never had any sexual experience in the past, so your first time, second time might be a little difficult and it might be uncomfortable or discomforting for you. Social factors are also very important. Social factors such as some religious taboos, social restrictions. For example, you belong to a community or a society where like sexual activity is considered unhealthy or a sexual activity is considered like not a, you might not be very open and comfortable. If you have any sexual identity conflict, that can also cause a problem. Current life stressors also play a impact on your sexual health. Any sort of job stress, financial stress, any sort of stress so these are some of the psychological factors. Now we'll briefly discuss about certain types in the female sexual dysfunction. So first, we can focus on sexual desire disorders. So in sexual desire disorders, there are two types: hypoactive sexual desire disorder and sexual aversion disorder. So in hypoactive sexual desire disorder, this involves a deficiency or absence of any sort of sexual fantasies and desire for sexual activity. Like the woman will not feel like or have a desire to indulge in any activity, any sexual activity. If someone tries to initiate, she may like resist that and show little motivation for indulging in any sexual activity. Next is sexual aversion disorder. In sexual aversion disorder, women experience like persistent or recurrent and extreme aversion and avoidance of any sort of sexual contact with a partner. So this may result from some of the previous traumatic experiences such as childhood abuse or some repeated painful experiences in the past, or from some of the early developmental conflicts that have left a mark on your mind and you're unable to overcome that. So you become completely aversive to any sort of sexual contact with your partner. Next category is sexual arousal disorder. Again, this includes two types. The first type is female sexual arousal disorder. So in this involves persistent or recurrent difficulty with sexual relationships, which leads to distress and difficulty in intimate relationships. So this can lead to conflicts with your partner because the partner may expect something else and you are unable to feel that sort of arousal. But again, this leads relationship issues or some other medical conditions. Second category in this is persistent genital arousal disorder. So in this involves persistent genital arousal disorder, which involves a prolonged and distressing in which there is absence of or delay of orgasm after a normal sexual activity or normal sexual excitement phase. And this can be because of different partners. Again, like women can have fear of pregnancy, they can have some fear regarding rejection. So any sort of stressful activity leads to women being preoccupied with something else during that time, and it can contribute to this disorder. Apart from this, we have sexual pain disorders, and which includes vaginismus, and it basically involves an involuntary and persistent constriction of the muscles of the vaginal area, which prevents women to have any sort of sexual intercourse. Even when they want to do it, they are unable to do it because it is so painful. The entire experience is so painful and it can be so traumatic for them that they are unable to indulge in the experience.
तो अब जैसे हमने डिस्कस किया अबाउट ऑल दिस डिसऑर्डर्स, when it comes to understanding and when it comes to diagnosing these disorders, बहुत ज़रूरी है ये समझना कि एज वी डिस्कस ना बहुत सारे मेडिकल कॉजेज होते हैं. वी हैव टू रूल दोज थिंग्स आउट डेफिनेटली. सो वंस वी हैव रूल्ड आउट एवरीथिंग, ऑल द मेडिकल कॉजेज, देन वी ट्राई टू फाइंड आउट कि ऐसा क्या मेंटल हेल्थ, इधर देयर इज अ इलनेस जिसकी वजह से सेकेंडरी सेक्सुअल प्रॉब्लम्स आ रहे हैं, या फिर जैसे उसको हम बोलते हैं व्हेन वी स्टार्ट टू अंडरस्टैंड इट, इट इज इट अ जनरलाइज्ड सिचुएशन कि आपकी लाइफ के हर सिचुएशन के अंदर ये प्रॉब्लम आ रही है, हर पार्टनर के साथ में ये प्रॉब्लम आ रही है. टू स्टार्ट विद लाइफ लॉन्ग रहा है, शुरुआत से ही इस तरीके के इश्यूज रहे हैं, योर डिजायर वाज लो, यू वर नॉट एबल टू हैव ऑर्गेज्म, या पेनफुल सेक्सुअल एक्टिविटी होती है हर बार, एवरी टाइम यू हैव इट, या इवन ड्यूरिंग मैस्टरबेशन इट इज लाइक दैट, और ये किसी इंसिडेंट के बाद में या कोई इलनेस के बाद में ये चीजें शुरू हुई हैं. तो ये जानना बहुत जरूरी है. ऑल दीज थिंग्स विल एक्चुअली डिफाइन कि हम इन डिसऑर्डर्स को कैसे ट्रीट करते हैं. बट येट अगेन विल नॉट डिस्कस टू मच इन डिटेल अबाउट द ट्रीटमेंट ऑन ऑल दोज एस्पेक्ट्स. But one thing that I would like to say is that फीमेल सेक्सुअल फंक्शनिंग इज समथिंग जो हम बहुत कम बात करते हैं. We do not talk about these things with even with our partners कि हम क्या actually expect कर रहे हैं. बहुत बार even just by having a conversation, a meaningful conversation with your partner will lead to reduction in the problems that you're facing. क्योंकि when it comes to sexual functioning, it is not just one person thing, it is a two-way thing. So your partner needs to have a very, and you and your partner needs to have a very good communication when it comes to sexual intimacy. बहुत सारे प्रॉब्लम्स वहीं पे ही काफी हद तक खत्म हो सकते हैं. देन बिकॉज ऑफ सम साइकोलॉजिकल ट्रॉमा या कुछ और प्रॉब्लम्स हुई हैं या कुछ और इलनेस आया है जिसकी वजह से ये प्रॉब्लम शुरू हुई है, देन वी माइट हैव टू गो इनटू डिटेल्स ऑफ इट. वी माइट हैव टू फाइंड आउट कि क्या कारण रहे हैं. देन इफ रिक्वायर्ड मेडिकेशंस, if not, then long term psychotherapies are, they are started. Again, not involving just one person. Most of the times हमें as a couple involve करना पड़ता है. Definitely we maintain the confidentiality. We maintain that, you need to be comfortable when it comes to discussing these things with your therapist, with your doctor, and with your partner. And eventually we try to build upon that relationship as a couple and as a therapist and as a doctor with the patient. And that is a long term relationship which we develop, and we work upon the things ki, okay, there are certain areas, these are the areas that we need to work upon, and we try to help people with that problem that they have been suffering, which they did not talk about for a very long time. बहुत बार ऐसा होता है कि when a person comes for treatment, they hesitate in telling, even depending on कि वो मेल थेरेपिस्ट है या मेल डॉक्टर है या फीमेल डॉक्टर है, it doesn't matter. They usually hesitate in telling कि मैं कैसे बताऊंगा ये, अगर मैंने बता दिया तो ये मुझे समझ पाएंगे कि नहीं. अगर as a female, am I even supposed to say these things? As a female, I am supposed to serve my husband. I have to do as he says or does whatever he likes. मुझे अपने सेक्सुअल डिजायर्स या अपने प्रॉब्लम्स के बारे में ना तो इन्हें बताना है ना किसी और को बताना है, डिस्कस नहीं करना है, एंड विच अल्टीमेटली लीड्स टू अ वेरी dissatisfied sexual life, and then a lot of problems in the relationship, they start arising. So my only like at the end I would just say this thing: when you with your partner, please try to have a very good communication when it comes on this part. When you come to a therapist or when you come to a doctor, even if it is some other problem that you're coming with, try to discuss about your sexual life, about your sexual history with your doctor or with your therapist. Try to clarify your doubts. As we discussed, बहुत सारे myths होते हैं, and when it comes to sexual functioning as such, बहुत सारे myths हैं, बहुत सारे, because if you Google anything on internet, you will find like hundreds of wrong things written here and there, and you try to just accept it. As we talked about sex education, uh, our sex education in Indian culture, I would say, बहुत सारा pornography से आता है, which is completely wrong. And we start thinking about it कि हाँ यही इस तरीके से ही होता है, इसी तरीके से मेरा पार्टनर मुझसे एक्सपेक्ट करता है, and this is how I have to behave. So please try to clarify those doubts when it comes to discussing your sexual functioning with your therapist or with your doctor. बहुत बार टाइम कंस्ट्रेंट्स होते हैं जिनकी वजह से डिस्कशन नहीं हो पाता है, बट टेल योर डॉक्टर और योर थेरेपिस्ट दैट आई रियली वांट टू डिस्कस दिस थिंग एंड आई हैव बीन फेसिंग these issues. If and when you say it, they will definitely try to find out some time. They will try to make time or book another session just for this thing, because as doctors and as therapists, we do understand that it's a very important part of your life and of your relationship, which needs to be discussed about and clarified. So now we would like you guys to ask any question that you have, any thing that came up during the discussion that you want to clarify. You can go ahead and we'll try to figure out certain and clarify those areas. Yes, ma'am.
Good
you
afternoon,
can.
everyone. Hello.
Yes, please.
Yeah, I have a teenage daughter, so this question crosses my mind sometimes. Is there any age which can be called safe for girls to start a sexual active life?
Again, sexually active life and safety is very it is a very uh, objective, sorry, I mean very subjective discussion. I would say it depends on, according to our culture. Usually we do not expect, legally, if I talk about, below the age of 18 years, you cannot have, it is completely illegal in India. If you talk about experimentation, it starts as early as during your puberty, even before puberty. So that is a very difficult. But what I would say here is that uh, you, as a mother, can sit with her and have a conversation of safe sexual practices, what she expects from the whole experience, and how can she actually, you can just provide her with an atmosphere where she can discuss about what are her beliefs. Because starting, when it will depend on her if she is comfortable or not. But as and when it happens, she needs to be prepared in her mind what she is expecting, what she can expect from herself and from her partner, and how she can actually have a good communication along with her partner, so that she do not end up with that anxiety that I am supposed to perform this, I'm supposed to do certain things just so that my partner feels happy. So those are the things that you can maybe discuss with her. uh, and if she is a teenager, I don't think there is anything wrong in discussing those things. You can, sit her down and have a conversation.
Mhm. Thank you.
So, adding to what Dr. Anu just mentioned, so first and foremost, it's important for us to normalize this whole concept of sexual health. Instead of considering as a sacred concept in household, it's important for us to normalize this, that it's okay to discuss these things in school. In today's time, school is also spreading a lot of awareness. They're holding workshops. That's the same way. It's important that we normalize this in our day-to-day, lifestyle also. So if your daughter is not comfortable in discussing this with her father or any male person, you are the right person, and you can educate her about everything that she can experience, her curiosities, and you can clarify any sort of myths that she has regarding this entire concept in her mind.
Thank you.
Anybody has any questions, please let us know. We'll be able to answer them. So if we don't have any more questions, we'll like to come to the end of the webinar. So in this webinar, we basically discussed about women's sexual health, its importance, what are some of the concern areas that females can come across, and what are some of the myths related to sexual health in general. So lastly, we would just like to end on this note that we understand that there are a lot of like myths related to sexual health, stigma, misperceptions, discomfort, but then we have to normalize sexual health just as we talk about physical health and mental health quite openly. It's important for us to normalize sexual health, have discussions, spread awareness regarding this, because only once we spread awareness, we'll be able to come forward, speak to our partners about it, speak to our doctors, because a lot of times females are not even able to identify what they're going through. And the reason of conflicts can be like sexual discomfort in general. So it's important that we normalize this, we come forward, we try to identify if this thing is an area of concern, and we speak to professionals